Did you know that your chronic headaches, your sinus congestion, or even your gut problems can be caused by your mouth? Today I'm going to present some unusual signs that actually could be dental related. Your teeth and your gums do more than just help you smile and chew your food. They're still connected to the rest of your body, so having a problem with your mouth can manifest in other areas as well. So let's talk about headaches. So how can your headache be related to your teeth? Well, it can be if you ever grind or clench your teeth. So bruxism or teeth grinding is when you're basically rubbing your teeth together. And a lot of times people do this when they are sleeping, when they don't even realize that they're doing it. But then they'll wake up with this jaw pain or this ear pain or this massive headache. Or sometimes people will grind and clench their teeth throughout the day, again, without realizing it because they're super focused on something. And again, it can lead to this headache or this jaw pain. Because when you're doing this act of grinding your teeth or clenching your teeth all night long or doing it for multiple periods of time, then you're going to stress out these jaw muscles and also muscles that go up to the side of your head. This can lead to a lot of inflammation in your TMJ or your temporomandibular joint, which can cause pain by your ear or your jaw, and it can even spread up to your head. So some key signs to look out for if you're having this pain more in the morning time, whether it's a headache or your soreness of your jaw or your teeth, or if you have any popping and clicking with your jaw, like if you ever open your jaw and you notice like a pop or a click in your jaw, or even any jaw deviations where instead of opening and closing straight, your jaw tends to drift towards one side and then go back to normal or something like that. For example, a jaw deviation can kind of look like this. I know that probably looked really weird, so I'm not sure if that did it justice. But one of the simplest solutions if you do grind or clench your teeth is going to be to get a bite splint made or a night guard made. These can be custom made at your dentist, but they're basically like a thicker retainer that you'll wear on just your top or your bottom teeth. And that way, anytime you grind or clench your teeth, instead of actually wearing your teeth away, it's going to deflect those forces. So first of all, it'll protect your teeth and prevent your teeth from getting damaged. But also, since it's deflecting those forces, it's going to kind of glide your teeth back and forth rather than actually engaging those jaw muscles. So that means it's going to prevent those headaches and that jaw pain. I will say though that to get those deflection of those forces and to get rid of that jaw pain and those headaches, it's best to get it custom made at your dentist rather than going over the counter and getting one of those athletic or mouth guards made, because those ones will protect your teeth, but they will still engage those jaw muscles. And also in regards to grinding and clenching your teeth, it's also related to your sleep. So there is a huge link between sleep disorders like sleep apnea or other sleep problems with grinding and clenching your teeth. Now this actually gets a little bit more complicated, so I made a separate video where I went into more detail on that. So check the description below where I put a link to that other video. Now let's talk about how your dental health can relate to sinus problems. Your upper molars and your upper premolars have these long roots that sometimes go really close or even into your sinus. So if you've really been neglecting your dental health and then you end up getting a really big cavity in one of these upper molars and it spreads to the nerve inside that tooth, it can lead to an infection in the tooth. And this is probably when you'll need a root canal or where you remove the nerve inside that tooth to get it out of pain. Because a tooth infection could be really painful. Unless your tooth has died, then it wouldn't be painful, but you still need the root canal, but that's a separate story. The main point is if you have an infection in one of these top teeth, it can spread along those roots and actually spread even into your sinus. So that means having a sinus problem is actually second to having your tooth problem. Now, the only way to fix a tooth infection is to get rid of the source of the infection. That means either doing that root canal to get rid of that infection or taking that tooth out. Taking antibiotics is going to be kind of like a short-term fix to help fight those bacteria. But if that tooth is causing that infection and that tooth is still there, then it's still going to be infected. And if you don't do anything to fix it other than taking antibiotics, it's probably going to come back and hurt again. Now, just like your tooth pain can spread to your sinus, it can also happen the other way around. So if you have a sinus infection, since your upper molars and premolars are so close to that sinus, it can mimic tooth pain. So one time I had a sinus infection and I felt like I had a cavity or something going on with my upper teeth because every time I walked or took a step, then my upper molars and premolars were hurting. But it's just because those roots can be really close to that sinus and that sinus pain can spread to those teeth. Now, luckily, most of the time, if you have a sinus infection, it's not going to actually spread to your tooth and cause a tooth infection, especially if you treat it in time. But regardless, I would suggest going to the dentist if you have any sort of tooth pain because they can kind of rule out any tooth infection or anything like that. And that way you'll know for sure it's just a sinus problem and not a tooth problem. Or it could be something completely different. You won't know until you go to the dentist and get it checked out. Now, I also want to talk about how your mouth can relate to digestive problems and gut problems. So chewing food is the first step in your digestion process. And it's literally the mechanical breaking down of bigger pieces of food into smaller pieces of food. And then combined with that, you mix it with your saliva, which has these enzymes called amylase and lipase. Amylase is necessary to break down starches, and lipase is there to break down fats. Now, this is all really important because let's say you do not chew your food properly and you have these large chunks of food that are entering your stomach. That means the stomach has to work harder to break down this food. That also means that it can cause bloating, indigestion, or some discomfort in your stomach. This can also lead to gut imbalances or irritation if it's not digested properly in your stomach. So it's really important to thoroughly chew your food. Also, when you chew your food and break it down more, it actually increases the surface area of that food in your stomach. Not only does this make it easier to digest, it also makes it easier to extract nutrients. So that means that simply not chewing your food enough could lead to deficiencies in vitamins and minerals, even though you're actually still eating that food. Now, what could cause people to not chew their food enough other than simply being lazy when eating? The biggest cause is missing teeth. So if you lose a tooth and you do nothing to replace it because you think you're gonna chew fine with your other teeth, eventually that could catch up to you. And anytime you lose a tooth, it's gonna be harder to chew. And this could lead to you swallowing those larger chunks of food. Now, we see a clear sign of this when people lose all their teeth and they end up in dentures. So if you end up in dentures and you don't have like implants or something to retain those dentures never really fit 100%. Yeah, sometimes you can get them to fit pretty good, but you're not going to be able to eat the same foods as thoroughly as you used to. And people who wear dentures or even like partial dentures tend to have a lot more symptoms of like GERD or acid reflux, and they also rely on chewing softer and unhealthier foods. And this all has to do with the fact that they cannot chew food as well as someone that has healthy teeth. You could also struggle chewing if you have pain with chewing. If you have like jaw pain, or if you have a cavity or something like that, that's causing you to refrain from chewing on one side or even both sides. So it's really important to get any tooth pain or anything like that checked out by your dentist so that you can actually start enjoying your food. Now, the bacteria in your mouth also play a big role in your gut health. For example, if you have gum disease or periodontitis, then this can lead to bacteria that are in your mouth entering your bloodstream and damaging your gut. And actually, there's been links between gum disease and IBS or irritable bowel syndrome and even leaky gut. There's even been links to a specific bacteria. So one bacteria that is involved in periodontal disease is called Porphyromonas gingivalis, or P. gingivalis for short. This is one of the key bacteria that's involved in severe gum disease. And this same bacteria has been linked with inflammation in the gut and also systemic diseases like diabetes and cardiovascular issues. So I'm hoping you understand the importance of taking care of your teeth and your gums. Again, your mouth is the first part of your digestive process, and your mouth and your gut share the same microbial communities. And there's even studies coming out that are linking having poor oral hygiene to things like IBS or Crohn's disease or ulcerative colitis. And it's not just with your gut. Having poor oral health can affect the rest of your entire body. If you have a dental infection, it's not just going to affect your sinus or your jaw or something like that. It's going to tax your entire body because it's going to cause a systemic problem. Now, one last surprising symptom I wanted to talk about is if you have shoulder or neck pain. Yes, this can also be related to your mouth and also kind of your jaw as well. It really has to do with your posture. If you have poor oral posture, where essentially if your mouth is hanging open and your tongue is resting against the floor of your mouth, that's considered bad oral posture. And when your jaw is hanging open, it's going to tend to pull your head forward. And when your head falls forward, it starts to weigh more on your shoulders, and this can lead to that shoulder and neck pain. Proper oral posture would be having your lips closed, your tongue against the roof of your mouth, not just the tip of your tongue, but also the middle part of your tongue, and your teeth slightly touching. This will naturally also keep your head up straight. Now, if you've had many years of this bad oral posture, you might already have something like a head forward posture where your head kind of sticks forward. Now, there are some exercises you can do to help correct this, specifically involving your tongue. Now, I actually made a separate video on this exact topic, so I'm putting that link in the description below, so make sure you check that out. So I hope you're understanding the importance of your oral health and how it's not just affecting your teeth, but it can affect the rest of your body. So it's important to make sure you go into your dentist every 6 months, get checked for any cavities or any gum disease or any other problems that could be starting. And also take care of your teeth at home. Make sure you brush and floss every day at the very least. And also make sure you're just chewing your food enough. If you have to take any steps to kind of correct your bite or something like that, like braces or something like that, and you want to talk to your dentist, you can do that. But simply focus on just chewing your food every single meal. That being said, thank you guys so much for watching. I hope you liked that video and I hope you learned something about the importance of your oral health. If you haven't already, make sure you hit that thumbs up button and subscribe to my channel below. And I will see you in the next video. Did you know that your saliva is more than just spit? It's like a secret weapon for your mouth, and it defends against bacteria, against gum disease, against cavities, and bad breath. And when people have conditions of low saliva, then they are at a huge risk of getting more cavities and gum disease. And saliva even does more than that.